If your child came home from school today and seemed quieter than usual, would you know if it was just a bad day or the beginning of something much more serious? Here's a statistic that should terrify every parent. According to the Centers for Disease Control, 1 in 5 children between the ages of 3 and 17 has a diagnosable mental health disorder. That's 20% of our kids. And here's the part that keeps me up at night. Less than half of them will ever receive treatment. Not because the help isn't available, but because parents simply don't recognize the signs until it's reached a crisis point. Right now, while you're watching this video, your child might be struggling with anxiety that makes their stomach hurt every morning before school. They might be experiencing depression that makes everything feel heavy and pointless. They might be enduring bullying that's destroying their sense of safety and self-worth. And they might not tell you any of it because they don't have the words, or they're ashamed, or they think you won't understand. The World Health Organization reports that half of all mental health conditions begin by age 14, but most cases go undetected and untreated during these critical years. This isn't just about feeling sad sometimes or getting nervous before a test. We're talking about conditions that, left unaddressed, can alter the entire trajectory of a child's life, affecting their education, relationships, physical health, and future opportunities. But here's what gives me hope, and why I'm making this video today. Research from the National Institute of Mental Health shows that early intervention is extraordinarily effective. When parents recognize the signs early and respond appropriately, the outcomes improve dramatically. Children who receive support for anxiety and depression during childhood show significantly better long-term mental health than those whose symptoms went unrecognized. The same is true for bullying. Studies from the American Psychological Association demonstrate that children whose parents intervene effectively in bullying situations recover faster and show fewer long-term psychological effects than children who face it alone. Your involvement isn't just helpful. It's often the difference between a child who struggles for years and a child who develops resilience and healthy coping strategies. So today, we're going to cover what you absolutely need to know about childhood anxiety, depression, and bullying. Not vague advice, but specific, scientifically backed information about what to look for, what it means, and exactly what to do about it. If you care about protecting your child's mental health, hit that subscribe button right now, because this might be the most important video you watch this year. Let's start with anxiety, because it's the most common mental health condition affecting children today. According to research published in the Journal of the American Academy of Child and Adolescent Psychiatry, anxiety disorders affect nearly 1 in 3 adolescents, and the average age of onset is just 6 years old. 6. That means anxiety often begins before children even have the vocabulary to explain what they're experiencing. Here's what parents need to understand about childhood anxiety. It doesn't look the same as adult anxiety. Dr. Anne Marie Albano at Columbia University, a leading researcher in childhood anxiety disorders, found that children often express anxiety through physical symptoms rather than worrying thoughts. Your anxious child might complain of stomach aches, headaches, or feeling sick frequently, especially before school or social events. These aren't fake. Anxiety is creating real physical distress. Research from Yale University identified several key warning signs that distinguish normal childhood worries from clinical anxiety. Watch for excessive reassurance seeking, where your child repeatedly asks if everything will be okay. Notice if they avoid situations that other children their age handle comfortably, like sleepovers, school cafeterias, or birthday parties. Pay attention to sleep disturbances, particularly difficulty falling asleep due to racing thoughts or frequent nightmares. The developmental stage matters enormously. Dr. Philip Kendall at Temple University, who has studied childhood anxiety for over 30 years, found that anxiety manifests differently at different ages. Preschoolers with anxiety show extreme separation distress and may regress in development, like wanting bottles again or having toileting accidents. Elementary-age children develop specific fears and may refuse to go to school. Teenagers with anxiety often withdraw socially and may develop perfectionism or panic attacks. Now let's talk about depression, which looks very different in children than it does in adults. The research from the National Institute of Mental Health is clear. Childhood depression is real, it's common, and it's frequently missed because parents are looking for adult symptoms. Adults with depression often feel sad and cry frequently. Children with depression are more likely to show irritability and anger. Dr. Joan Luby at Washington University conducted groundbreaking research on preschool depression and found that children as young as 3 can experience genuine depressive episodes. Her studies using brain imaging showed that depressed preschoolers had measurable differences in brain structure and function compared to their peers. This isn't just moodiness or a phase, it's a biological condition affecting their developing brains. The warning signs of childhood depression, according to research published in Pediatrics, include persistent irritability or anger, loss of interest in activities they previously enjoyed, changes in eating or sleeping patterns, low energy, difficulty concentrating, feelings of worthlessness, and in severe cases, thoughts about death or self-harm. In younger children, you might notice they stop playing imaginatively or they make negative statements about themselves that seem disproportionate to reality. Here's what's crucial to understand from the research. Dr. John Wise at Harvard University found that untreated childhood depression doesn't just go away on its own. His longitudinal studies tracked children over decades and found that childhood depression significantly increases the risk of depression in adulthood, substance abuse, relationship difficulties, and even physical health problems. The earlier depression begins, and the longer it goes untreated, the more severe these long-term effects become. Now let's address bullying, which has evolved dramatically in the digital age. Research from the Cyberbullying Research Center shows that traditional bullying and cyberbullying often occur together, creating a situation where victims have no escape, not even in their own homes. The mental health consequences are severe and well documented. Dr. Dan Olweus, whose research at the University of Bergen established the scientific foundation for understanding bullying, identified 3 key characteristics that distinguish bullying from normal conflict. It's intentional harm, it's repeated over time, and there's a power imbalance between the aggressor and the victim. One-time conflicts or arguments between equals aren't bullying, even though they can be upsetting. The effects of bullying on mental health are profound. A comprehensive study published in JAMA Psychiatry followed children who experienced bullying into adulthood and found they had significantly higher rates of anxiety disorders, depression, and suicidal ideation, even decades later. The researchers found that bullying victims showed changes in stress hormone levels that persisted long after the bullying stopped, suggesting that bullying creates lasting biological changes in how the body responds to stress. What many parents don't realize is that bullying affects different children differently based on their existing vulnerabilities. Research from Duke University found that children who already have anxiety or depression are more likely to be targeted by bullies, creating a vicious cycle where mental health problems make them vulnerable to bullying, which then worsens their mental health further. Signs your child might be experiencing bullying include unexplained injuries, lost or damaged belongings, frequent complaints of illness to avoid school, changes in eating habits, difficulty sleeping or nightmares, declining grades, sudden loss of friends, avoidance of social situations, and decreased self-esteem. According to research from the National Center for Educational Statistics, most children who are bullied don't tell adults about it. They feel ashamed, fear retaliation, or believe adults won't effectively help. Here's the critical connection between all 3 issues we've discussed. Research published in Child Development found that anxiety, depression, and bullying often coexist and reinforce each other. An anxious child may become a target for bullying, which can trigger depression. A depressed child may withdraw socially, making them more vulnerable to peer victimization. Understanding this interconnection is essential for effective intervention. So, what do you actually do when you recognize these signs in your child? The research provides clear guidance. First, Take it seriously. A study from Boston Children's Hospital found that parental validation of a child's emotional experience is one of the strongest predictors of positive mental health outcomes. When children feel heard and believed, they're more likely to open up, accept help, and develop healthy coping mechanisms. Dr. John Gottman's research on emotional coaching shows that parents who acknowledge their children's feelings without dismissing or minimizing them raise children with better emotional regulation, stronger peer relationships, and lower rates of behavioral problems. This means instead of saying, "You're fine," or "Don't worry about it," try, "I can see this is really bothering you. Tell me more about what's happening." For anxiety and depression, the American Academy of Pediatrics recommends professional evaluation if symptoms persist for more than 2 weeks or interfere with daily functioning. Cognitive behavioral therapy has the strongest research support for treating childhood anxiety and depression. Studies show that 70 to 80% of children with anxiety disorders respond well to CBT, often within 12 to 16 sessions. Regarding medication, research from the National Institute of Mental Health's landmark Treatment for Adolescents with Depression study found that the most effective approach for moderate to severe depression combines therapy with medication, producing better outcomes than either treatment alone. However, for mild to moderate cases, therapy alone is often sufficient and should be tried first. For bullying situations, research from the Always Bullying Prevention Program, one of the most extensively studied anti-bullying interventions, shows that parent involvement is critical. Document everything. Keep records of incidents with dates and details. Contact the school immediately and request a meeting with administrators. Most schools are legally obligated to address bullying and have specific protocols in place. Dr. Susan Swearer at the University of Nebraska studied successful bullying interventions and found that the most effective approach involves collaboration between parents, school personnel, and mental health professionals. Don't try to solve it by contacting the bully's parents directly, as research shows this often escalates the situation. Work through official channels. The most important thing to remember is this: mental health conditions and bullying are not character flaws or signs of weakness. They're serious issues that require appropriate support and intervention. Children don't just grow out of anxiety, depression, or the trauma of bullying, but with early recognition and proper support, they can absolutely recover and thrive. If this video opened your eyes to signs you might have missed in your own child, subscribe to the Parenting Blueprint for more evidence-based guidance on protecting your children's mental health and well-being. Your awareness and action today could literally change the course of your child's life. Don't wait for a crisis. Trust your instincts and seek help when you need it.